I'm Dr. Annie Savage. I'm a naturopathic doctor. By the end of today's video, I want you to understand what estrogen does in your body, the symptoms when you have too much of it, and how you can get rid of any excess estrogen in your body. If you like this video, please click the thumbs up, subscribe to our channel, and click the bell for notifications so you know when we have new videos out every week. The classic view of estrogen in the history of medicine has been that it is important for menstruation and childbearing, and that's it. We now know that estrogen essentially touches every organ and every system in our body. Men also have estrogen, so it's important to talk about it in their body as well. We now know that estrogen has an effect on learning, memory, cognitive ability, neurodegeneration, and neurodevelopment. Primarily, estrogen is made in the ovaries. Then we also have minimal amounts being made from the adrenal glands, the arterial walls in the heart, and the placenta. Estrogen is also made in small amounts in fat cells and our brain. Estrogen's main job is proliferation and growth. So it is giving women all of those women sex characteristics. It's developing the vaginal walls, the uterine lining, our breasts, our wider hips, our fat cells. And estrogen is also managing our ovaries, our eggs, and it is a major part of our ovulation. We know that estrogen must be balanced with progesterone, or that growth and proliferation can essentially get out of control. We will see genetic mistakes and overgrowth, which is actually cancer. So we always want our estrogen to be balanced with our progesterone. Estrogen is very important for bone growth. We know that estrogen is stopping the resorption of our bones and then helping to grow our bones. So that's why we tend to look more closely at our bone health in our perimenopause and menopausal women, because their estrogen levels are declining. So we know that there's increased bone loss as well, and we want to keep track of that. So we see increased incidences of strokes when women are taking oral birth control. The reason for that is those synthetic hormones, those synthetic estrogens are elevating our estrogen profile too much. So when estrogen becomes too high in our body, we're more at risk for stroke and other brain injuries. When estrogen is at the correct level in the body, it's very neuroprotective. It'll help protect our brain from strokes, from spinal cord injuries. Estrogen has a positive impact on our coronary arteries and the blood flow through them. So again, when estrogen is at a normal or good level in our system, we know that our blood flow through our heart is less turbulent because the dilation of those vessels can happen properly and easily with the right amount of estrogen. We see more heart disease and more issues with coronary artery disease in women as they age, probably because their estrogen is declining as they age. So it's something that we need to look at and make sure that our estrogen is not too high or too low. You also may know that estrogen is linked to some cancers, specifically those female cancers, breast cancer, uterine cancer, and cervical cancer. We also know that an out of control estrogen level or unchecked estrogen level can lead to fibroids, endometriosis, and PCOS. So this is another reason why we want to balance your hormones when you're younger, so that we can avoid all of these other concerns, but also so that as you age and your hormones change, they can do so in balance, and then you are not burdened with all of the symptoms of perimenopause and menopause. Are you experiencing any symptoms of excess estrogen? Comment below if you are. The symptoms of excess estrogen would be bloating, abdominal weight gain, some headaches with your period, possibly acne within your cycle, either ovulation or PMS right before your period. Now, to reduce that excess estrogen, we really want to support the liver. So your liver is actually metabolizing any excess hormones that are in your system. So to support your liver, you want to drink enough water, which would be half your body weight in ounces per day. Limit or completely avoid caffeine and alcohol. Avoid taking any exogenous hormones if at all possible. That would be your oral birth control pill. and support your liver by eating really, really well. So flax seeds are very liver supportive. They have lignans in them that support our detoxification pathways, and brassica vegetables. Those stinky vegetables such as broccoli, cauliflower, bok choy, cabbage are all fantastic for your liver. So grab a handful of those, 1 to 2 cups per meal, and you'll increase your fiber, improve your digestion, and be supporting your liver. To further balance your hormones, download our seed cycling guide below, where you can use food as medicine to start to balance those hormones much more easily. We also have a 21-day detox plan just for you so that you can jumpstart your journey on balancing your hormones. Don't forget to subscribe to our channel, click the bell for notifications so that you know when we have a new video out every single week. Thank you.